اعوذ باللہ من الشیطان اللعین الرجیم بسم اللہ الرحمن الرحیم اللہم صل علی محمد و آل محمد وعجل فرجہم. Today we are going to discuss parasitic respiratory disease in equines, especially in horses. In mature horses, a worm, a parasite which is known as Dictyococcus ornfieldi, that produces a parasitic bronchitis, and when bronchitis occurs there is a persistent cough. So clinical signs include a persistent cough for months or even longer than 1 year. Possible increased respiratory rate can also be noticed, and there is adventitious lung sounds also present, which may diminish in intensity. Non-progressive syndrome. This is non-progressive syndrome and diagnosis. So far as the diagnosis is concerned, a very carefully taken history is essential. It can be very difficult on clinical signs alone, and frequently is by a satisfactory response to specific anthelmintic therapy. Hematology may show an eosinophilia. In hematology, we can observe eosinophilia, and fecal examinations, positive results can be interpreted with more confidence than negative ones. Tracheal wash, eosinophils, and on occasions Dictyococcus larvae with no bacteria. Treatment is very simple. Anthelmintics are known to be effective against Dictyococcus species, which may acquire a different dose rate from that for routine worm control. For example, fenbendazole should be given at the rate of 15 milligram per kg body weight, and thiabendazole should be given at the dose rate of 440 milligram per kg body weight, and these drugs should be repeated at 48-hour intervals. And then ivermectin should be given at the dose rate of 200 milligram per kg body weight. We can also say that fenbendazole and thiabendazole combination should be given early in the morning as the dose has been described, and then after 48 hours ivermectin injection should be repeated at the dose rate of 200 milligram per kg body weight. Prognosis of the disease. So far as the prognosis of the disease is concerned, a full recovery is made following anthelmintic treatment, but the horse may become infected again, and infections in horses may be more common than the incidence of respiratory disease indicates, with most horses not developing patent infections. Shared grazing with donkeys, which have a much higher incidence of Dictyococcus infection and develop patent infection in a high percentage of affected animals, is a likely source of infection. Foals, Parasitic ecorum. In foals, this worm can also be present, and that should be differentiated with Dictyococcus. So anthelmintics, they should be given in horses in combination, like fenbendazole and thiabendazole. Fenbendazole dose is 15 milligram per kg body weight, and thiabendazole dose is 440 milligram per kg body weight. And after 48 hours, ivermectin should be injected at the dose rate of 200 milligram per kg body weight. This was a little bit about parasitic respiratory disease in horses. Thank you very much. Jazakallahu khaira.